Let's discuss about an autoimmune disorder which is warm autoimmune hemolytic anemia. This warm autoimmune hemolytic anemia is a condition where the autoantibodies are produced against the red blood cells, and the optimum temperature where these autoantibodies bind with the red blood cells is the 37 degrees centigrade, which is at warm temperature. This condition is more commonly seen in case of females than that of males, and this condition is more common than that of the cold type of autoimmune hemolytic anemia. We often see the warm type of autoimmune hemolytic anemia in most common. Warm antibody mediated autoimmune hemolytic anemia. This warm antibody mediated autoimmune hemolytic anemia is IgG antibody mediated. This warm condition is more common than that of the cold AIHA. This condition is more commonly seen in case of females than that of males. And the clinical findings seen in these patients is the splenomegaly, which is in moderate level. And we also see polychromasia, fragmented RBCs and nucleated RBCs. These IgG antibody mediated antibody production against RBCs, this binding of IgG antibodies to the RBCs occurs at the optimal level at 37 degrees centigrade. And splenic macrophages, this IgG antibody is often get trapped by the splenic macrophages, results in splenomegaly in case of subacute presentation. And the conditions which trigger this warm antibody mediated autoimmune hemolytic anemia, it can be primary or secondary, and the primary cause is often idiopathic, and the secondary cause is mainly seen in the presence of SLE, rheumatoid arthritis, inflammatory bowel disease, and some of the drugs like methyldropa, ceftriaxone, and some of the infections like HIV. Molecular mimicry is the most common cause for the development of antibodies in the presence of these conditions. And let's see the treatment plan available for the diagnosis of warm antibody mediated autoimmune hemolytic anemia. First line of treatment is the oral steroids. Even low dose rituximab is also used. In case of relapse, we find hemoglobin at very low level. And the second line of management will be the splenectomy. And even the drugs like rituximab and cyclophosphamide also can be tried in these patients. These are most common symptoms presented by the patients of warm autoimmune hemolytic anemia. And let's see the treatment plan that is available for the patients of warm autoimmune hemolytic anemia. And the steroids are the mainstay of treatment, and even low dose of rituximab also can be seen. In these patients, we often see enlarged spleen because of most of the fragmented RBCs often get trapped in the spleen. Hence, we see the splenomegaly. As we see the splenomegaly and also features of DVT or deep vein thrombosis also can occur in these patients, and hence the treatment that is available also in second line of management, we need to do splenectomy also in these patients. And even the other drugs like rituximab and cyclophosphamide also in treating these patients. And thank you for watching.